Hello, I'm Dr. Maury Markman from City of Hope. And in our last session, I noted briefly, all too briefly, multiple factors that may impact survival of an individual patient diagnosed with cancer. Some inherent to the biology of the cancer itself, but also very strongly influenced by the treatment employed against that cancer. And of course, also those factors that individual patient for himself or herself can undertake, such as stopping smoking or exercising, that might influence outcomes. I then noted the absolutely critical role of clinical judgment. In fact, I would personally argue that there is nothing that can replace the essential role of excellence in clinical judgment in optimizing survival outcomes for patients with cancer. For example, the experience and skills of a surgeon who decides whether it is appropriate or not to attempt a curative resection of a malignant mass in a 78-year-old patient with a relatively recent history of cardiac ischemia. Or, in my own area of clinical interest over the last 40 years, whether a particular woman diagnosed with advanced ovarian cancer should undergo an attempt at primary surgical site reduction of the malignancy versus a less aggressive neoadjuvant approach with chemotherapy, then followed by surgery. The decision in these cases, and so many more, relies on the experience of the individual and the organization, knowledge of relevant literature, critically individual patient factors that clinician needs to take into consideration, including the potential impact of comorbidities. And let me be clear, it is not just surgery. For example, what about that patient who has previously been radiated, who's got a pain due to a mass on a pelvic sidewall? Is it safe to deliver additional radiation to help improve, even if it's only short-term, symptoms versus the potential harm to be caused by that radiation? That requires that skill, that experience of the radiation oncologist. And of course, we can come up with so many examples of the skills of the medical oncologist or the GYN oncologist who is faced with a patient with known comorbidities that might be relevant for a particular antineoplastic therapy. Is it safe to give that drug? Does one modify the dose? Does one modify the schedule? You have to watch the patients carefully. That is that skill, that clinical judgment that will do the best for that individual patient. So in summary, in my opinion, there is nothing that can replace the role of clinical judgment, this critical factor in optimizing individual patient outcomes. But more to come in our final segment on this topic.